From unceded and unsurrendered Algonquin territory, we welcome you to the FNHMA virtual town hall on COVID-19. Tomsey, my name is Marion Crow. I think you guys all know that by now. I have the privilege of serving as the Chief Executive Officer of the First Nations Health Managers Association, and a special shout out to all of my Saskatchewan brothers and sisters. I'm from Treaty 4 territory, Pie Pot First Nation. I'm really excited to bring back a couple of guests on this week's town hall. Before we get to them, though, I just want to say a really special thank you to everyone who is letting us in to your homes, to your nations all across Turtle Island via the internet, and the radio stations who support this information sharing from credible and reliable sources. It is another season that we've gone into to share this information with you regarding COVID-19. So I hope we're not back in April, but you never know. We'll do this and be here for as long as you need us to be. Now, let's dive right in. We are breaking down and geeking out, as I like to say, on the topics of vaccines. That's right. If you have a question, and I know there are so many questions out there, please send it in to us. Maybe we'll pick it out and answer it on the air for you today. So if you have that question, run over to your computer if you're listening on the radio and send us a question to fnhma@ihtoday.ca. So again, just for anyone who has a question regarding vaccines, fnhma@ihtoday.ca. Let's get started, shall we? So, welcoming back. Happy New Year. We haven't had a chance to talk since we came into this 2021 and said, oh, goodbye 2020. I think we could all agree that that's so nice to get rid of. Now, Pamela Wolf-Roberge, I always mess up on this, Pam. I'm so sorry. Pamela Wolf-Roberge. Thank you. I've known you forever. Me bad. But welcome. I hear you're going to share some epi stats with us, Pam.
Great. Thanks, Marion. And you got it right, Pam Wolf-Roberge. And thank you for having me back today at the FNHMA Town Hall. So as Marion said, my name is Pam Wolf-Roberge. I'm the director at the Communicable Disease Control Division at Indigenous Services Canada. I grew up in Ottawa outside of my community, but I'm a member of Tdap First Nation. I'm mostly French and Anishinaabe with a pinch of German and Russian sprinkled in there. And I'm joining you today from my spare room located on the traditional and unceded territory of the Algonquin Anishinaabe people here in Ottawa. So as Marion noted, I'm here today to share with you an update on what we're seeing in terms of COVID-19 infection among First Nations living on reserve. I'm also going to share a brief update on Health Canada's recent approval of the Spartan Cube test kit. So I'll start with those two items, and my colleague Kim Daly, who's a senior nurse manager working on my team and leading the work on the vaccine planning, is also back and joins me today, and she'll be helping to respond to those vaccine questions that came up last week and any vaccine questions you send today. So in terms of the COVID-19 infection among First Nations living on reserve, as of January 27th, we've seen a total of 15,089 cases. Of those cases, 12,770 have recovered, 704 have been hospitalized, and 151 of those have passed away. So as of yesterday, we have a number of active cases at 3,068. So right now, the overall case rate that we're seeing for infection among First Nations living on reserve is about 1.5 times higher than what we're seeing in the general Canadian population. We're also seeing, though, that the percentage of hospitalized cases is lower at 4.5% among First Nations, 7.7% for the Canadian population. And same thing for in terms of the percentage of cases that have passed away. It's 0.9% of First Nations living on reserve versus 2.6 in the Canadian population. So while the rate of infection is a bit higher for First Nations living on reserve, we are seeing lower rates of those who are having to be hospitalized and those who are passing away. And since the start of the pandemic, we've watched COVID-19 infection rise and fall. We saw our highest peaks in wave 1 at the end of April last year, and we saw cases start to drop over the summer months and then them starting to increase again in September. We really started to see those cases accelerate in October and more recently this month in January. So we had 2,365 new cases during the week of January 10th until the 16th, which is our newest peak, with 3,985 active cases during the week of January 17th to the 23rd. So it's an alarming rise. I think it's an alarming rise in our highest peaks in this wave, but we are starting to see some preliminary signs of hope this week. We're starting to see the number of reported active cases decreasing for First Nations living in communities, with 3,068 active cases, as I just reported for yesterday, versus 3,985 last week. So we'll see if that trend will remain, and let's hope that it does. But in the meantime, it's important for everyone to not become complacent. And I know for me, and likely people listening in and watching in here, it can feel and it can be very difficult in the middle of winter when the days are shorter, and it may be more difficult getting outside because it's freezing or you're snowed in. But it's important, and I encourage everyone to continue to follow those public health measures to keep you and others safe. So remembering to wash your hands regularly, to wear a mask when you can't maintain a safe distance, avoid gatherings in crowded spaces, and stay at home and stay away from others if you're feeling sick. So I also told you at the start that I wanted to share with you just a brief update on the Spartan Q test kit. So since last week, when Dr. Wong and Kim were here at the FNHMA last Friday, Health Canada announced their approval of the new Spartan COVID-19 test kit. So you may remember last spring in late March, Health Canada had approved the Spartan Q. However, what happened was additional work was needed to work through some of the performance issues that were coming up with the swab and the efficacy of those tests. And as a result, over the past few months, work is being done to work on that, on those efficacy challenges or performance challenges, and clinical trials were completed. And on Friday, Health Canada announced their approval. This is a test kit that can be used now on patients and not just for research, and it can provide results within approximately an hour. So that's good news. More tools at our disposal. And for that, I think, Marion, that's all for me today on my update. So I'll pass it back over to you.
Thank you so much, Pam, for bringing the current information and information regarding this new approved tool for us to be able to help combat COVID-19 and continue to keep us safe. And while the numbers are showing that we're not faring well in this second wave, tools like this being approved at this time are definitely so helpful to all of the nations across Turtle Island. Now, again, viewers, listeners, if you have a question regarding what was just shared with you on those epi-stats, or want to have a deeper dive or have a question for Pam on the information that she's just shared, again, feel free to send that question in to us. That's why we're here, is to facilitate having a back and forth exchange. And so that email, once again, is fnhma@ihtoday.ca. And hey, another tool that you can use is FNHMA's info point service. So if you have a question and don't have time to get it on the air today, and you have something you want to know about COVID-19, our staff, hello, Kathy, who's standing by, waiting for your emails and waiting for your phone calls at InfoPoint. We thank you for serving our nations by providing that information. And with more info on InfoPoint, we have a quick commercial to share with you.
Created by your First Nations Health Managers Association, we introduce InfoPoint, a convenient and accessible helpful desk for First Nations health managers looking for credible sources of information on COVID-19. Don't have time to dig? Talk to a real person now at 1-855-446-2719 or email infopoint@fnhma.ca. Indigenous Health Today is another resource of information by region at ihtoday.ca.
And thank you for allowing us to share that information with you in your nations and your homes. And I love that I can go to the folks in the studio. I just like saying studio, like I feel like legit or something. We're all at home, you know that, to viewers and listeners. And we have some amazing tech support making all the magic happen so that you can listen to us and see us on all of the different communication mediums that we are using. Now, let's dig right into why we invited my fellow geekster back to this town hall. Kim, I'm sorry, I don't mean to call you a fellow geekster, but we do share a passion for wanting to know about immunizations. So, Kim Daly, welcome back to the FNHMA Town Hall. Come geek out with me.
Thanks so much, Marian. I think after hearing, the epi data from Pam, that gives me more encouragement to continue. I need to look to something hopeful, and of course, we're talking today on Bell Let's Talk Day. So we're looking for areas of hope, and I hope that this conversation today helps bring clarity. I think part of the anxiety around this is not knowing and needing answers. And you'll see as I do this presentation, I'm going to look over here because I'm always checking, because the science does change. That's what we love about science. So I don't want to ensure that I do add to the understanding. So today I am joining you in my basement office at the traditional unceded territory of Algonquin and Anishinaabemowin people here in beautiful Ottawa, where it's a sunny day. Probably still very cold out there, and I'm happy to come back and join you with these questions. And I put it in my bio so you can call me the geek, the nerd, or whatever it is, but spreading information does bring me some joy. So Marian, I think you had a list of questions. I'm not sure if you're going to ask, and then I'll try and answer them.
Absolutely, Kim. Let's dive right into that inbox now. I am so sorry. I muted myself. Radio folks and viewers, I apologize for that little delay there. You'd think after 10, 11 months now that I'd know the mute button. So just laugh with me. That laughter is medicine. What can I say? All right. So, changing pace here. This is not funny business. We do have a number of questions for you. Pam, Kim, either one of you, feel free to answer. But let's just start right at the top. And we do have a question from a resident of Ontario. It's very specific, Kim. So again, feel free to come back at a later time if you don't know the answer to this. But the question is from a nurse who is saying that smaller First Nation communities don't have a full-time community health nurse, and they actually share a FNIB nurse between smaller First Nations. With the nurses traveling from one community to the next, administering the vaccine, what measures are in place to ensure the nursing staff are tested for COVID-19?
So thank you for that, Marian. We did reach out to Ontario Region to get the more specifics, and they did not have time to respond, but I can tell you what we do know is we take that very seriously. So this is one of the areas where we're really trying to get our nurses vaccinated prior to administering the vaccination, so they're not part of the spread. There have been measures that have been taken in for the nurses who are coming into community where they're self-isolating prior to entering community. That has been helpful. It is Indigenous led, so it's been very helpful that communities are letting us know what they're comfortable with. And in the North, in Ontario specifically, NAN is running the vaccination program where they are bringing in paramedics and nurses who are specifically trained to this vaccination, who are isolated, who are safe to come in and immunize prior to. So we do know that immunization alone, and we'll get to those questions later, will not protect. So it's not this force field yet. So they still need to practice their public health measures, but we don't want to be part of the problem. So I think that's a great question. We're certainly looking at not burdening the nurses that are already in the communities providing their primary care.
Thank you so much, Kim. We really appreciate your point as well to Nan. Nan, I've been following on social media, and I have to say, if you don't follow Nan, you really should. There is some great culturally relevant and really credible information on vaccine confidence is what I want to call it. And I remember their last, and I may have mentioned it last time, but they have a great post that says, here's a book of matches, and they have the bush behind it. And it says, you wouldn't go out into the bush without your matches. So they're implying you wouldn't go out into the world without your vaccine. And they've done an amazing job at sharing some of the leaders who have been vaccinated, some of our elders who have been vaccinated already. And we thank them for sharing all of that information on social media. I specifically look at Twitter and see that great information there. Again, for listeners and viewers, if you want to get your question in, it's fnhma@ihtoday.ca. Kim, we understand that there has been a pause with Pfizer. What can you tell us about that? What does this mean for us who are waiting for our nations to get vaccinated if they haven't already been? Are we still going to be in the safe period between the first vaccination and the second vaccination? Do you want to tell us a little bit more about that, Kim?
Sure. Thanks, Marion. And so many questions in there to unpack. So first and foremost, we really have to credit the government for going out and procuring multiple sources of vaccine, because if Pfizer was our only source, then we would be in a little bit more than we are now problems. What you do know if you're involved in vaccine planning is these are normal things that happen. Is the manufacturing of a vaccine is not something to be taken lightly, nor do we want them to take it lightly. There's lots of competition out there for sure, but I think that's getting lost in all this muddle. So if the manufacturer signals to us that they need more time, I think it's in our due diligence to give them more time. What I don't recommend is going against manufacturers' guidance. So, you know, the extension of the first to the second has been gone back to NACI and the manufacturer, and 42 days is within the comfort zone. You know, that continues to change as we continue to get more evidence. So keep coming back. Two places you want to go to is FAC's website and NACI's website. Basically, you can find NACI through FAC as well and find out the information as it changes. So what you heard last week could change this week as evidence comes through. So not to worry, there are people doing this role with us, and they're trying to find the best way to get it. And, you know, as we have safety concerns going forward, I'm excited to say there's 2 more vaccines going through the process of approvals right now too. They have a lot less complications in the temperature, so that's a good news story. And and they're not the mRNA vaccine. So there's something out there for everyone. If somebody is, you know, I had a lot of the questions you provided was a question about the mRNA, and you know, the nerd in me loves the mRNA vaccine. But if you've decided for you this is not your vaccine, there's other choices there. One that's in the hopper, as I call it, is plant-based. So that really meets a lot of needs, no preservatives. So this vaccine, you know, the efficacy rate's a little bit different, but it's still going through its clinical trials. So there's lots there. We are in a hiccup, but we do know, and I'll say it probably 300 times today, that the vaccine is not the only part of the solution. So we are going to need to continue to do our public health measures. So vaccination does not open all our doors, or we'll be back where we were, you know, at the beginning. So we don't want to go backtrack on this.
Thanks so much, Kim. Really appreciate you talking about that little bit of a delay and hiccup, and really sharing with us that there are a number of solutions that are coming to the table. I know the plant-based immunization will probably be appealing to a number of Indigenous people as well, just looking at that kind of holistic perspective and leaning on the great medicines that we already have being provided by Mother Earth, right? So, I mean, there is an option for you, and our job here is to inform you so that when you get the opportunity, that you can make that decision that's informed by the science, that's informed by experts, and a credible source. Facebook has so much great information on it. I'm not knocking it, but please don't, think that Facebook is a doctor, because we want to follow the information being shared by credible, reliable, and trusted sources. There's a little rant for today. I'm going to dive right back into the inbox here. And Kim, there's a question regarding children not being eligible for the vaccine. How will we achieve herd immunity if we cannot vaccinate children for another year? Is this accurate? What do you make of this question?
Yeah, thank you, whoever wrote that and used the word herd immunity. I want to hear more of that. That is one of our indicators of success, that people are understanding that. When I was part of the vaccination team for the city of Ottawa, we got these little stickers that talked about herd immunity. So if you don't know that, that's your homework today. Please look up herd immunity and see what you can do to be part of that. That's the bigger solution. So kids, here's what we know about kids. First of all, the first clinical trials that were done were not done in kids, and that's standard. We don't usually, push our kids up front and say, here, let's test it on them, right? We want to see what it's stable in the certain age group. So we go to the risk group was the higher age group, still showing that. So the kids are not even if they were eligible according to NACI, they're not in the group of Q1 that would get the vaccine because they have not been proven to get as sick from it. So we are prioritizing this based on the epidemiology. And as that changes, we change our priority. But NACI did change the wording a little bit because they wanted to be comfortable and they heard what was saying, and the studies keep changing. So they did change it to if the child is between 12 to 15 years old and in consultation with their healthcare provider have done a risk assessment that feels that they would be better benefited, if that's a word, if they would benefit from the full. And this is the whole thing. Don't just go and take them for the first vaccine and think half there. No, you have to have the full vaccination. Then that is something you can do. It's all around a risk assessment though, too. So, what your child is going through, is the risk higher if they get this COVID-19 versus avoiding until there's more studies. This is not saying it's dangerous for children. It's saying we haven't completed our studies on that. We do know it's happening. The 12 to 15 are particularly. That's not the rate that's been impacted negatively either. So we're really seeing that the need for that data is further along as we go. So for right now, they don't tend to be negatively impacted.
Thanks again, Kim. Lots of great information that you've shared with us in that. And before you hit that mute button, I just want to remind folks who don't know what NACI is. What's that acronym again for all of our viewers and listeners?
Always say I don't use acronyms, and there I did. National Advisory Canadian Immunization. Let me check that. Oh, I use it too often, don't I?
We speak in acronyms. It's like our third language, I think. So no worries while you look for it. I'm going to pull another question.
National Advisory Committee on Immunization.
National Advisory Committee on Immunization. Now, they're the ones that laid out the framework that we're following, right?
Yes. And so they have been so adaptable. Hats off to NACI in this time. So when I talked about the first time I came to talk to you guys at the town hall, they first laid out the guidance and it wasn't specific enough. When it was translated to provinces and territories, they kind of said, I'm not sure what you're actually saying here. So Dr. Wong, Dr. Evan Adams went back to them, saying, it doesn't really cover what we need it to cover to say for Indigenous populations, and so many times there's misunderstanding in Indigenous populations only living on reserve and not speaking to urban, not on reserve. So they came back with more, generous interpretation of that. They also came back when people were saying, wait a minute, I'm pregnant, I'm breastfeeding, I want to be covered with this vaccine. What's up with not letting me? And they came back again with similar to the children, saying, if through your health assessment, and it's more generous than the children one. So if your health assessment with your doctor, you do your risk assessment, then you are eligible. Again, it has to do with they did not, volunteer pregnant women during this study, but through the course of the clinical trials, people did become pregnant. And so we did get some data there, which showed good results. So I answered the question without you even asking it.
No, but that's a great one. I know I'm so excited that we're about to have an FNHMA baby. Our executive coordinator, a big shout out right now to Kelsey Thompson from Akwesasne, who tries to keep on top of the executive at FNHMA. Good luck, Kels, but it's going to prepare you well for that baby coming along. And I've always wondered, can she get vaccinated? And so is that a conversation between her and her health provider then?
Yeah. So both with, pregnant people and people with chronic conditions, you have regular appointments with your doctors where this should be part of your conversation. But again, can I plug other vaccinations too? Yes. She should be talking to them about other vaccinations. One of the proven things is as you become an adult, you start to forget about your vaccine. Sort of triggers when you're pregnant and have babies and have to get vaccinated. But how many of you have gone out and gotten your TD? Like you should have had that every 10 years. If you can't remember last time you had it, you're probably due for it. This is one of the things in pregnancy too, that there's a Tdap vaccination that's very important to get to prevent the transmission of pneumococcal, which is more prevalent after pregnancy. So these are things you can do. Become informed. Don't just talk about the COVID vaccine, but talk about all vaccines. Am I safe? Do I have the titers for MMR? That's another thing we check during pregnancy. So a vaccination conversation does not stop after you're in grade 12 when your parents give you your yellow card and say, now off you go into the future. There are many other vaccination conversations to be had and to stay up to date on to keep your health.
Thanks, Kim. Let's just continue. And Kelsey, I hope you were listening to that answer. And also my little sister, Stephanie, who's expecting a month after Kelsey. So I'm just excited for all these babies to come into the world. I swear it's like the COVID boomers that we had when folks were coming back from war. It's just going to be a surge in population after all these lockdowns. We know what you were doing during the lockdown. So with that joke inappropriately said, let's talk a little bit more about some restrictions and age-specific questions. And, here's the question, Kim. There is a health services organization that is advising that the following persons should not be vaccinated at this time. And they're saying persons with or in a certain age group. 1, with autoimmune diseases. 2, with severe allergic reactions to medication, or 3 persons under the age of 16. Directive that's being given. And if I were to fall into the autoimmune disease, and tell us what that is, Kim, because really I hear it, but I'm not sure I know what it means. Does that mean that this notice means that they're ineligible to receive a vaccine? Geek out with me some more.
Yeah. So great questions. And autoimmune, what doesn't it cover sometimes, right? So some people will kind of say, I think my disease is an autoimmune disease. So it's really, I'm not leaning on the doctors 100%, but I'm saying only you and your healthcare provider know what the limitations are. I really want to lean into this one with the allergic reactions though, because that can be really anxiety producing. If anybody's had an allergic reaction, the max I've ever had is the hives, and it's unpleasant to say the least, but it's not closing of airways. So if you do have a severe allergic reaction to medicines, then this is a conversation to have with your healthcare provider. Please make sure you inform the person who is immunizing you as well. And there are levels that we take after that. I certainly, on all of the immunization clinics I have been giving immunizations through, have those special precautions. And in most situations, all have ended up well, that we kept an eye on them and made sure. We do know that allergic reactions can happen after you leave, and that you're instructed to go and follow through with your healthcare provider immediately if you're finding any of these symptoms. But that is, again, back to some specific populations. Again, they didn't ask for the clinical trials. If you have severe allergic reactions, please come forward, because they wanted to study it on the population that would be largely represented. So it's not an exclusion per se, but let's get this out there. And the other part about a clinical trial is it gets confusing. So if you already know somebody has an allergic reaction, autoimmune, is this a symptom of their disease, of their reaction, or is this the vaccine? So in order to give us some of that clarity, we have to remove that. Now we're moving into more of that. And the more that we roll out this vaccination, we will have more people with an autoimmune allergic reactions and such. So, I keep going back to making sure that you go back to your healthcare provider. But again, if you have any of these conditions, I'm not going to list them here because it tends to get people just into, oh, well, she didn't say my disease, so therefore I'm not in it, right? If you don't know if you have an autoimmune, so what is it? It's impacting your immune system in some way. If you don't know, that's okay to ask your healthcare provider. People have always come up to me and said, I don't know. I happen to have celiac. It's an autoimmune disease. People don't know that because I always call myself a glutenoid and I downplay it a little bit, right? So, it's important, part of your learning, to know that you fit into there, but not that you're boxed into there. So I would still be in conversations with my healthcare provider when my turn comes up, a good candidate to get the vaccine. So it's just having those conversations, making sure there are virtual platforms with your healthcare provider too, where you're open to contact them and find out more.
Wow, that was a lot to unpack in that one question. While I look at more questions coming in for you, Kim, I do want to say a big thank you to new listeners, new viewers coming on board, and to all of the people who have been watching from day one. Karina, thank you for sending in your comment. We appreciate you watching and getting this information. Jeremy, I am this enthusiastic 99% of the time, so I get really annoying to those in my household. I do. I do want to say, Freddie, thank you for tuning in as well. As you see, we get these live, and we just appreciate you tuning in to get your credible and reliable information right here on the FNHMA COVID-19 Town Hall. And a special hello and thanks for the hearts, Robin and Lydia. We hope you feel wrapped in this big virtual hug of love and information as well. And Kim made a great point. It's Bell Let's Talk Day. We need to be kind. We need to be patient. And you know what? If somebody around you in your circle has tested positive for COVID-19, and after hearing all of the updates that Pam shared with us at the top of this hour, there are a number of folks who have been tested positive, especially when we look at Manitoba, Saskatchewan, Alberta. You know what, folks? This is such a critical time to be saying, I care about you, I love you. Go drop a care pack off at the front door, walk away, send them a quick text and say, hey, there's a lot of love in that bannock that I left at your front door, chili, spaghetti, hangover soup. You guys know what I'm talking about. You know, the nourishing stuff we love to eat when we're not feeling good. Go drop it off, and let's get rid of this COVID-19 stigma. There's just nothing more to say except for patience and kindness. So thanks for sending in the love. Another special viewer that is one of these ladies will know is Paula. Paula Hadeen is watching. Big shout out from your family at FNHMA. Thank you so much, Paula, for continuing with us. All right. So we were just chatting about the autoimmune diseases. We had a conversation about pregnancy as well. And I do want to share with you, Kim, that Kelsey's proud to let us know that she's all up to date on her immunizations before she welcomes that little Mohawk baby into this world. So very happy about that. Let's go over to, well, I just didn't do that. Sorry, a big long, what are we talked about allergies. Is there anything more you want to say about warnings regarding people with allergies not taking the vaccine, Kim, or do you feel good about, people with that, that have allergies kind of stepping back a bit and exploring their other options?
Again, I think we now publish online. By we, I'm using that royally. It's the Public Health Agency publishes online what the adverse events are following vaccinations. They can be specific to certain lot numbers as well. So that means it's not necessarily the vaccine, but something that happened along the traveling of that vaccine. So I really encourage people to stay informed on that. Also, when you're inform yourself of what the normal adverse events following an immunization are. Those are called APHIS. See how I didn't use the acronym that time? What they are for flu seasons, and do some comparisons for there. So if you're getting your other vaccinations with this severe allergy anyway, then you're probably okay, but I don't give you a clear pass. Talk to your healthcare provider. But many of the same ingredients are utilized depending on the mRNA is really new. The plant-based ones will have some of the same ingredients. I always go back to some of these allergies, adverse events to, how much do you care and pay attention to what you're eating? Somebody with a severe allergy does not go out to eat very often because they cannot control that environment. So if that is a severity of your allergy, then this takes a serious look at with your healthcare provider. And maybe you're getting that vaccination right in there in a healthcare setting so you feel safe. And again, it goes back to what you do with your other vaccinations as well.
Pam, I think you might be able to handle this question, but I'll leave it to both of you, capable, informed women, to figure out who wants to take a crack at this. This question coming in from a very special Tyndonega Mohawk that I call, it's a Mohawk miracle. Sorry, that was so bad, but that's what I say every time I see him, which I miss you a lot, by the way, to this person who has this question. Hi, Marion. When will the Spartan mobile rapid PCR test be available, and how are we going to get this delivered to Indigenous communities? Great question.
It's a great question. And what it shows that enthusiasm that I think we all have in terms of wanting to increase our testing capacity, especially as we're seeing these cases among our communities rise in this wave. What I can say right now is each jurisdiction, so all the provinces and territories, they will be the ones who will be working to procure. And at Indigenous Services Canada, just like we've done for past point of care test kits. So for example, we've talked about the Gene Expert machines in the past. Those are rapid test kits, not point of care. But, we work with our regions across the country to identify and assess what those needs are. is our regions work with you in the communities to understand what those needs are, and then we work with our colleagues federally to make sure that those are distributed. So this was just approved Friday, but I understand next steps will be doing exactly this, as we've done for past rapid care test kits.
Thanks so much, Pam. So anyone who is looking to deploy these, I think the best piece of advice here is keep in touch with your regional FNIB office. That is the conduit to all of the information sharing, how you're going to put your requests in. Make sure you pick up that phone so that you're calling in Edmonton, Regina, Fort Capel, Prince Albert, Winnipeg, Thunder Bay, Sioux Lookout, Ottawa. I mean, can you tell I used to work there? I must be feeling a little extra spunky today. I won't share what's in my coffee at this time, but I spent 20 years in that system and I finally paroled out of serving my federal time. I put in 20 hard years at the First Nations and Inuit Health Ranch. So know where those offices are. Just keep up with your information and your calls as well. So let's go back. There's another question here, Kim, and I think it's one for you. How will the vaccine, like if I've already had COVID-19, should I be getting immunized if I've already had it? What does that mean for anyone who's tested positive? Should we really be knocking at the door right away for that?
Yeah, so that is circling and circling and circling. So I hope we come to a landing on this. Yes, but you should have recovered. So I don't want you going out and exposing people. So make sure you're recovered from the COVID-19. But yes, you still do need to get the COVID-19 vaccination. If you fit into the age group, the risk group that is being vaccinated, then you should be. If you're still, amongst the age and risk groups that are waiting till the summer, it won't impact you. So if you have COVID-19 now or had it in the past, you're still eligible to go ahead. Keep informed, but that we don't expect that to change, that you still will need to have the vaccination and the two.
Thank you so much. And Carol Ann, I see your question coming in about what was that tool that Pam was talking about earlier, because your internet cut out just briefly there. We were really talking about the Spartan tool. So lots of information to share as that progresses, because a reminder, this was just approved by Health Canada. So stay tuned. Stay informed and keep your radio dial where it is, or your broadcasting platform, because we will be talking about this for a little while. All right, so I'm going to go back over to the inbox. And you know what, Kim, I don't necessarily like to go into myths and, that kind of thing, because people tend to remember the negative, not the positive out of it. But I'm going to be loyal to all of the listeners and viewers right now and get those myths addressed. So here we go. I keep hearing First Nations are the most vulnerable in our, I hate that word, but most vulnerable in our Canadian society. Why is this accurate, if it is, and why? I think that's a great question to be asking. We have a lot of non-Indigenous Canadians who tune in and listen on the radio, and they want to know, why are First Nations prioritized?
Because their risk is higher, and it's not just First Nations too, if I might. It's Métis, it's Inuit as well. So it does disproportionately impact those populations. Why? That's a long-standing, I think right now you're attending at the same time a forum on systemic racism that's been going on, and so the overcrowding, the lack of access to equality in healthcare, whether that's on reserve or off. What we learned from and continue to learn is that there's certain parts of the population that do not have equal access. They might both live in Ottawa, but don't have equal access to continues to impact their health outcomes. We have been in discussions at tables about, when we discuss that 80 is the old age for a certain population and should be vaccinated. In some populations, it's more 55 to 60, and that it should be allocated to that age group so that we are covered there. But it is a long-standing issue that it goes back to things in colonialism that we need to work on together to fix in order. And, it doesn't happen overnight. It happens with conversations. It happens with action. We need to take action now to fight against all of this and make sure that this doesn't continue to be the historical that plagues a certain generations and populations. So we all have a role to play in that. And I, with you, do not like the word vulnerable. I think we gasp when we hear those things. It makes it sound like it's something within the population instead of what has been impacted onto the population. If anything, it's a resilient population that has come through many, many trials. It's one that we continue to learn more and more about. So not just First Nations, but yes. And so that is why NACI did recommend. And at first in their recommendations, they talked about living in close quarters. But then as we unpack that more, that's not the only risk factor that's impacting. So there's also lots of other chronic illnesses that have been brought on from other colonial impacts. So it is important that the population is prioritized. And then our role is to make sure that the population feels safe to get the vaccination. So it's partnerships together.
I love what you said in that, Kim. And, coming from a non-Indigenous Canadian, your understanding of all of the social determinants on health that impact us in our nations and what contributes to some of the challenges that we face. As you mentioned, Kim, there is a national federal meeting happening right now regarding racism in the healthcare system against Indigenous peoples. And I will quote Minister Miller, who said after that conversation yesterday that there is no vaccine against racism. And we have to unpack all of those topics of discussions when we talk about folks who are scared of getting a vaccine. The last time the federal government showed up on the res with some needles, didn't look all that great. We're going to own that. We are going to acknowledge that there is fear, that there is hesitancy around getting vaccinations, whether you feel or have been a part of scientists who did many, many things to Indigenous patients regarding a whole host of things. That will dedicate a whole town hall to talk about some of the reasons as to why First Nations are scared to encounter the healthcare system and why it's so important that we have dialogues around making sure there is zero tolerance for discrimination in the healthcare setting. I did touch a tiny bit on the words vaccine hesitancy and vaccine confidence. So Kim, think about, what ISC is learning around vaccine acceptance in our nations. Do you foresee it being an issue? Has it been an issue? And how can we best inform our loved ones as to the safety of these vaccines? Wow, lots of things in that.
Well, I think this is doing what we're doing now. This is important, opening these conversations, being transparent. And that's why I say, look at the adverse events. Make sure you're informed, make sure you know about the vaccines are there. And we'll keep coming back to this table and filling you in on what we know and remaining transparent on what we do know and what we don't know. People are asking, I saw one of the questions is, when can we get back to normal? And, we have to be transparent. We don't know that yet. That doesn't mean we won't. It just means that if we do this wrong and get back to normal sooner than we should, the consequences are people's lives, and we talked about that. It is affecting the elderly, but elderly are very important. So, to do that to them, we need to keep following the best guidance going forward.
Thank you so much. And again, I'm going to point to some outstanding Indigenous-led organizations who are talking about this. And that's why we want to share with you people who have made the informed choices to proceed with vaccinations at this time. Again, Nan, keep knocking it out of the park. First Nation Health Authority, my goodness, you have been doing some amazing work around this that has cultural safe messages talking about vaccine hesitancy and vaccine positiveness. And on that note, I do want to let everyone know that next week we are going to have Dr. Shannon McDonald from the First Nation Health Authority, who's going to unpack some of this with me. Shannon is a long-standing partner in crime with me. I used to spend a lot of time with her at the Winnipeg FNIB office, and I'm just delighted to bring Shannon, Dr. McDonald, into the conversation next week. So make sure you continue to stay tuned in. Kim, we talked about herd immunity already, but what does that mean on reserve? Like, is there a distinction between on and off? What does that look like?
Yeah, there's certainly a distinction, because we need to have, when we started talking of this pandemic in a bubble, and this is when this will come understanding, and, whether you believe in the bubble or not, because, people have broken the bubble, but herd immunity is about having 70% of the population. I believe we can get there. And really, if you start with the people who you surround yourself with and ensure that they are vaccinated, there are some in there who won't be vaccinated right away. So that's how we protect our children who are not going to get vaccinated this first round. If we get vaccinated, the children start to become protected. We start to get back to some of that normality that we're talking about. I'll go back to the MMR vaccine. That is for measles, mumps, and rubella. None of us probably remember having any of those. But they found out later that you needed a booster for that. And I'm one of the people who will not uptake a booster. I've had 7 of them, and I still can get my titers to turn. I rely on you guys. You guys keep vaccinated so I don't get exposed to it. But if it gets into the community, I will get it. So this is where it becomes important. Some of us, our immune systems will not muster it up, but for the majority. So I still go get all my other vaccines because it just happens to be that one that I believe has that with the titers on it. So herd immunity is about thinking outside of yourself. And I think that's what we learned about the pandemic too, right? We're so isolated, but we care about others. I believe in humankind in general in that. So it's about thinking outside of you. I saw questions in there. Well, my risk is really low. That's thinking about you. But we have seen, and we do know about some of the other variants of this virus will be spread a little bit easier with less symptoms, that's dangerous for other people. All 3 of my children have cardiac conditions that you wouldn't see on them, but if you're a spreader to them, that's dangerous for other people. So keeping it into more of a collegial, let's help each other, that's herd immunity.
And I really appreciate this question because it really speaks to the values that we share as Indigenous people. As a First Nation woman, I am so proud to have those teachings about the collectiveness in sharing and caring for kinship, our brothers and sisters across Turtle Island. Those are the values that we have and embrace, is making sure that our cookums, our mushums, our medicine carriers, pickers, wisdom teachers all stay safe. So, it just goes part and parcel with what Kim has just described. All right, Annette, I really want to thank you as well for tuning in and sharing that you're finding this very informative. Let's hope that we can continue on this path of keeping you informed and a little bit entertained as well. right? We got to laugh a little bit as well. So we have a couple of minutes left to get into a couple of more questions. When can we expect vaccines to get on track? And I know you can't predict what's happening at Pfizer or Moderna or some of the other immunizations that are coming in the hopper, as we say. But are all First Nations going to get immunized in the coming months?
Yeah, so that has a lot to do. And, if you listen to the epidemiology report that Pam said, that's what ties in with the NACI recommendations. The NACI is not like mandated to all the provinces and territories. And the provinces and territories have the role of looking at the epidemiological data and seeing where the risks are there as well. And so in certain provinces, Q1, it was really mandated that First Nations, Inuit, Métis were prioritized. But we do know there's a huge movement towards Q2 really focusing on closing that gap and making sure that the majority are, who want to be. We always use that language. So I always say my part of that role is I really don't have control over getting that vaccine into communities. I have control of when it gets there, that we're ready to receive it. And I think that's as important as part. We know people are at the table saying this, we should have this, then let's make sure we're ready to take it so that when it comes, you get your vaccine, you get your second dose too. There is hope coming down. Like I said, Canada was great at, casting the net wide and making sure they got a variety of vaccinations. So I really feel we're in movement, but in order to manage expectations, and I tell you the same story I tell my family is we need to look at the long haul. We're not in a race, it's a marathon. And this idea of things going back to normal is not coming anytime as soon as we thought it would. So let's really hunker down. I'm not going to tell people to be patient because I'm probably the most impatient person ever. Keep asking questions. Keep saying where your vaccination is. I agree with that. Like, what happened? But listen to the answers when they're there. So sometimes it's not going to be what we want to hear. Nobody wanted to hear Pfizer was doing a close down. But that's the reality. So what's our next steps? What's the art of the possible from there? So we really know if we take this next few weeks, days really seriously in the lockdowns that some of our areas are in, that the vaccination will be kind of there, but we might be able to go back to some of what we were doing before. So that in combination, don't focus on the negative. If anything, for Bell, let's talk, like focus on what are the positives in your life and what you can do. So really make sure that you're informed, know the decision you're going to make on getting vaccination, and you can reach out to others and say, where is my vaccination? When can I expect? When do I fit? If you don't understand, this is a great venue for that, asking questions and making sure that you know where it is.
Wow, so much information here, and I can't believe how fast the time flies. One more quick question to get in. Hey, all the other urban Indians that are listening right now, I know you have questions about where are your vaccines? Are the Friendship Centers going to be offering vaccines? Is Wabano, for example, in Ottawa, going to be looking at this? Kim, I know that that's a tough question because we're still trying to figure all that out on the vaccine working group. But what do you say to this question about when do the urban populations get immunized, and have they already?
Thankful for so many champions on this topic. We were so far behind government at large of understanding where Indigenous people live, right? Let's just own that, and that the urban Indigenous population were not really kind of were on reserve. So no, there's lots of movement in this. The Friendship Centers, wow, they've really stepped up this pandemic, and we've been providing PPE support and such. They are going to be a great avenue, because when we talk about culturally safe and wanting to move away from systemic racism, where can we do that is having having places where it's safe for them to go get their vaccinations. So we are certainly maneuvering towards that. There is a vaccine working group for the urban Indigenous population. So they are moving towards it. I believe that we will see the vaccines being given in those, not just in Friendship Centers. So there's other areas in urban areas that we can speak to.
Well, ladies, guess what? We are at that time. Buzzer has run on us. I do want to say, though, that we are going to have Jocelyn from the National Association of Friendship Centers talk about this very thing on a future town hall. So make sure you continue to stay informed, get that credible, reliable information right here, whether you're tuning in to NCI Radio. Hey, Jordan, Garth, I really appreciate chatting with you, Davey, as well. And to everybody, I want to say a special thank you to Micmac Maliseet Native News, The Wolf 95.7, Nation News, Element FM in Toronto and Ottawa, Eagle Feather News, Tansei from your fellow Saskatchewan, Alberta Native News, CJWE, CFWE, CKLB, Co-op Radio in Vancouver, APTN News, the FNHMA Facebook account, and Nishnabeg Nation. Thanks for the great interview, Patrick. I loved sharing what FNHMA has been up to respond to COVID-19. We're also thankful that NCI FM radio also airs us all over the place in Manitoba. We have rebroadcast partners as well. Check out the Wolf 95.7 on Sunday mornings at 9, and you can hear this all over again. CKLB in Yellowknife Thursdays at 7. Co-op Radio Mondays at 12 p.m. A special thank you to all of the folks who make this happen. APTN, we love you. Thanks so much for putting us on your Facebook page. The team at Nation Talk, Chris, Dawn, Stella, the other Chris, and of course, merci beaucoup to Pascal for making sure you get this in French and English. Thank you to Indigenous Services Canada for joining us every week to share this information. So until next Thursday, please stay safe, be patient, be kind, and get informed here on the FNHMA Town Hall. With that, I say thank you. Hi, hi.